As Canada's Chief Public Health Officer, Dr. Theresa Tam has become the public face of Ottawa's effort to fight COVID-19.
I think we can cautiously move to what I would call a new normal.
A big part of that new normal are her near-daily briefings at noon Eastern, patiently explaining the massive effort.
Physical distancing and all the other public health measures that you've observed have been working.
Delivering the good news and the bad.
There are now 47,327 confirmed cases, including 2,617 deaths.
Dr. Tam is no stranger to pandemics and what it takes to fight them. She's advised the World Health Organization on deadly infectious diseases like Ebola and polio. Here in Canada, she was a key part of the team that responded to SARS and H1N1.
We took additional.
This time, she is leading the charge as the country's top doctor.
This is our chance right here, right now, and we need to act now and act together.
Now, as the country rolls into its third month of the COVID-19 pandemic, there are ongoing questions about how it's been handled so far. It's very far apart. It's very weird. This weekend, I sat down with Dr. Theresa Tam in Ottawa for her first in-depth interview since the pandemic was declared about her role and her response. Dr. Tam, hello.
Hello.
Thank you for making the time. I know you're very, very busy, and I appreciate it, and I'm sure Canadians will too.
It's a pleasure to be here.
I want to start sort of at where this started, and that was the first sign that there was something happening in Wuhan at the end of December. How quickly did you get a sense that there was something unusual unfolding there?
Well, I think immediately I felt that this was something that I really needed to take notice of. Probably the very morning of New Year's Day, because December the 31st was when some of this was being picked up. And by January the 2nd, I had already sent out an email to the Chief Medical Officer of Health saying that there's been an observation of this cases of pneumonia of unknown source. So there wasn't a lot really known, and this is why I'm concerned, because we've experienced SARS and we've experienced other outbreaks that could turn into something more serious. But at that time, you actually didn't know.
By January 14th, the WHO was saying there may have been human-to-human transmission, just may. By January 22nd, they said there was some evidence of that.
What we've seen are human-to-human transmission events amongst close contacts in families and in healthcare settings.
And yet, through that period, we, as a country, still decided to continue to let travelers arrive from China, as many as 58,000, more than 2,000 from Hubei province. And we were only screening at that point, correct me if I'm mistaken, symptomatic passengers. I'm wondering if we should not have been doing more at that point, given that there was already some evidence that this was being transmitted from human to human.
Yes, so it's always good to sort of look back and see, what actually happened. And that was when we had previously then instituted this enhanced border measures, where we provided information to all travelers from China to watch out for symptoms, etc. That was actually quite effective in that our initial travelers actually did very well in that they followed advice. In the end, in terms of travelers from China, if I recall correctly, throughout this whole period, until the beginning of March, we had about 10 travel-related cases, and they were all managed very well. So, could we have done more at the time? You can retrospectively say, yes, absolutely. You could screen more, or you could change your stance. But at the time, we had very, very few cases globally, and in Canada.
Again, I realize that these are hindsight questions, but I do wonder whether there should have been more said to Canadians about the risk, or should have been more done about the volume of, who cares how many people are coming from China? We should have just done more anyway.
Globally, as a public health community, we need to ensure containment and support containment at source. That is how...
In China.
That's right. And of course, if that is not working, more needs to be done. But at the same time, I think there were countries that did more. And in the end, it wasn't that effective if you actually think about the countries in the end that were impacted. Because I think from a public health perspective, we always knew that the border was just one layer of additional measure. It is actually quite anti-intuitive, I think, for Canadians. They think, well, if you just shut the border, that would solve the problem. I think even then, the illness, unbeknownst to most of us, had already traveled somewhere else, which actually became immediately obvious when British Columbia detected a traveler that had traveled to a country that wasn't really reporting cases.
Iran,
and then,
I think you mean, yes.
Yes,
Yeah.
and then the European countries.
Right.
And so some of whom had enacted border measures.
And there were some, at least in that first weekend, there was some confusion in airports that you were supposed to go to the electronic kiosk and say where you would come from, and some people got information and some didn't. It felt like there was some lack of coordination.
Yeah, so I think we went with some public messaging first.
Yeah.
Travelers are being asked to identify if they have flu-like symptoms, fever-like symptoms. There's additional questions on the kiosks as well that really target into the sort of regional area of Wuhan. And so this allows for a closer examination.
You can imagine the complexity of the international border. Just updating machines and getting the operational elements done does take a bit of time.
Sure.
So often the policy is out front and then you're still trying to implement. That was absolutely the feedback that we got as well.
Yeah.
So it's just layers of protection, really.
Sure.
Some of them could have been stronger at the beginning, but all the other layers were being put in at the same time. Right. So was it perfect? No. But I think, as you've seen over time, those layers have kept being strengthened as well.
We decided, I think it was March 18th, we closed the border to non-essential travel between Canada and the US. And you have said that some of those border measures did really help to flatten the curve. How big a health risk was the United States at that point?
Absolutely. It's the volume of to travel between the country is huge. All the signs were there that certain areas of the United States there were hotspots. And that was a bigger concern almost to our provinces and territories than Europe. Europe was a big concern, but also the United States. So we knew that more had to be done. But let's just dial back a little bit. In our pandemic preparedness, we actually had something called the North American Pandemic Avian Influenza Plan. Some of the assumptions in influenza pandemics, at least, was that if it was in one country, it was in the other country. And that border measures may not be that effective because, in effect, the virus is in both sides of the border. To execute an actual border reduction wasn't actually very obvious in any of our planning. So that was something that had to be, again, scaled up in our thinking, but it wasn't necessarily part of public health planning either, because we just felt, well, the virus is both sides.
Yeah, I remember everyone saying at the beginning, well, the viruses travel, shutting borders isn't the right thing to do because we need to know where people are and where they're going. It does sound to me like your thinking on that has evolved a little bit.
For the world.
Yes,
I
for the
think,
world, yes.
Again, imagine now when every country, the international travel has come to a grinding halt. Wasn't a scenario that was, I think, in anybody's playbook. The North American was felt to be a continent. Of course, now with hindsight, you go, okay, shutting that land border and all the other entry points is an actual option. Okay, But at that point, people were open-minded. Honestly, this was an option, and I think when our decision maker was saying anything is on the table, I think they really meant it, and they were considering everything. But the complexity of doing that, I think one can only imagine. But it was done in the end.